In this video, we are going to go over 7 tips to help reduce your back pain. That's 7 things that you can do right now to have a positive impact on your back pain. Hi, I'm Dr. Clay Sankey, chiropractor and owner here at TruMotion Therapy, and we specialize in the treatment of musculoskeletal conditions, everything from back pain to TMJ syndrome to plantar fasciitis. Today, we're going to be talking about back pain and 7 things you can do to help reduce your back pain. But although we're talking about back pain, this can pretty much apply to any kind of musculoskeletal pain or injury you might have. The first piece of advice is to stay active. Movement is medicine for the body, and motion is lotion for the joints. We're going to see improved blood flow, which leads to better oxygenation of the tissues, and there are countless neurologic benefits as well, such as improved mood and a decreased perception of pain. Maybe your typical form of physical activity is difficult to do under painful circumstances, but there's probably still something you can do. If walking is painful, try a stationary bike. If running is painful, maybe the elliptical or swimming. Whatever you can do to keep moving while still respecting the pain that you're in, the better. My second piece of advice is to prioritize sleep. Sleep is when recovery happens. It's when your body gets better. They've found that athletes who sleep less than 8 hours each night are significantly more likely to become injured. So while you have pain, definitely prioritize sleep so you can recover. My third piece of advice is to try to follow an anti-inflammatory diet. Since a lot of the pain that we experience can have an inflammatory component, the less overall inflammation we have in the body, the better. So the big hitters in an inflammatory diet, the things that can contribute to more inflammation in our diet are going to be refined nut and seed oils. This is your canola oil, sunflower oil, stuff like that. It's going to be sugar and white flour. So really anything in ultra processed foods that we see. If you try to stick to just the easy whole foods that you find, try to stay away from the processed junk, the really sugary stuff, the better. My fourth piece of advice follows similar lines to that last point, and it is to stay hydrated. This is especially important for back pain, because in our back we have these things called intervertebral discs. They sit in between the bones of our back and they provide cushion and mobility for our spine. Now our discs are 70 to 75% water, and when our bodies are dehydrated, our discs are dehydrated and they aren't as healthy as they should be. So make sure you're drinking plenty of water. The typical formula for that is you want to be drinking 1/2 to 2/3 of your body weight in ounces every day. So that is 1/2 to 2/3 of your body weight in ounces every day. The fifth piece of advice is to do things you enjoy with people you enjoy. Our emotional health is just as important in the way that we process pain as our physical health. So if you are happy and doing things that fulfill you, you are going to have less overall pain. There's actually science to back that up. So you might feel limited by your pain. You might feel like a hermit or like you just can't get out there, but I encourage you, take baby steps to try to do those things that you used to do that brought you joy, and your pain, your back in general, will thank you for it. My sixth piece of advice is to learn about your pain. Now, I don't mean go read the medical literature, and certainly don't go on WebMD, but we've all had that experience where we've felt something that just feels off and we get all worked up and nervous about it. Maybe you've Googled your symptoms and you're like, oh man, this is it. This is what's going to end me. And then you go to your doctor and, oh, it turns out it's nothing. It's not a big deal. It'll clear up in a little bit. Well, when you hear those reassuring words, you can almost feel the pain go away, right? Did anything change with what your doctor told you? Did anything change in your body? Probably not, but it was just the mindset around it. You just learned something about your pain and it made you feel so much better. So one thing I want to leave you with is that hurt doesn't always equal harm, Okay, just because your back hurts doesn't mean that there's a bulging disc or something real serious going on, right? I like to use the headache analogy in that you can have a headache, but it doesn't mean your brain is bleeding or that your skull is fractured. Your head can just hurt. Well, the same thing can go for your back. Your back can just hurt. So if you want to learn more about your pain, you should probably go see somebody, someone who knows what they're doing, someone that you trust as well. And that's going to bring us into our next point. And my last piece of advice is to go see somebody. You don't want to prolong the time period that you're in pain. The best time to see somebody is right now. Now is the time to take action, to take that first step towards feeling better. I understand that some people are fearful of what they might hear at the doctor or what their outcomes might be, but this is the best time to take that first step. A trusted medical professional, someone who knows what they're doing, will give you some actionable steps to start feeling better. They'll tell you what you can do or what you should stay away from, and hopefully together you can set up some goals to get back to doing the things that you want to do pain-free. So don't hesitate anymore. Start seeing somebody to help you get out of pain and get back to your life. You may have noticed that these 7 things take a very holistic approach to treating pain. We've talked about everything from physical activity to nutrition to mindset. And that's because the better the system can be as a whole, right? The healthier the system can be as a whole, the better off you'll be when pain does strike. So you don't necessarily have to do all 7 of these things. If you can dial down on one and just take those baby steps, take those little incremental steps, you'll be far better off for it. So if you need that additional push or you just need some help with the pain that you're experiencing, we would be happy to help you. Please visit us online at TruMotionTherapy.com to learn more.